Again, my name is Joy Rains, and the reason I chose this topic is because it is a major issue that often goes unnoticed and unheard. The children who go through this often become adults who, for one, never had spoken out about the sexual abuse and or received help coping. So my goal is to provide basic information about the issue and types of treatments to help those who have been affected. What is child sexual assault? The definition of child sexual assault is sexual contact between a child and an individual in a position of power and authority. It is a sexual act imposed on children who lacks emotional, maturational, and cognitive development and ranges from fondling to intercourse between a child in mid-adolescence or younger and a person at least 5 years or older. The statistics show that the prevalence of CSA, meaning child sexual assault, is 15 to 13% girls and 15 to 16% boys. It is also believed that 1 out of 5 children may be sexually abused before age 18. More specifically, about 1 in 4 girls and 1 in 7 boys. The most common age of CSA is between 8 and 12 years old. It is also true that about 10% are 5 years or younger. Child sexual assault usually lasts 1 to 4 years, and believe it or not, only 22% of all CSA cases are reported to the police, and over 80% of the offenders offended by age 30. However, due to the nature of CSA and people not reporting the issue, it is predicted that there may be significantly higher percentages of those affected by it. When it comes to offenders, contrary to what the media displays, offenders are not always random perverts lurking at parks and school grounds waiting to catch children alone, but they are more likely to be someone that the child knows, like a parent. Yes, both parents, women and men, sexually abuse their children. However, the men are far more likely than women to participate in incest. On average, 30% of CSA cases are from immediate family members. 60% are other acquaintances like friends of the family and babysitters. And the last 10% are found to be strangers. The effects of child sexual abuse varies widely, but the most common psychological and physical issues are depression, anxiety, self-esteem issues, sleep disturbances, re-victimization, personality disorders like dissociation, and post-traumatic stress disorder. Types of physical effects that may have taken place is internal bleeding, damage to organs. They may have even contracted a sexual transmitted infection like HIV or just simply have painful intercourse. One of the first steps to treatment is disclosure. Studies do show when a child disclosed information about the abuse, if the social response was positive, adult survivors suffered far less psychological issues. However, most cases show that the child is most often ignored or rejected after disclosure. There are a vast majority of treatments for adults who are in need of help treating current mental health issues and preventing future ones. In order to offer these treatments, it is necessary to consider their circumstances and their conditions, since adults who have suffered CSA may often suffer from substance abuse, eating disorders, personality disorders, issues with relationships, and depression. It is first important to treat their current conditions more so than the abuse. Once treated, then it is good to do cognitive reconstruction on the abuse. Certain techniques that are used are eye movement desensitization and reprocessing, most commonly known as EMDR, which is the patient recalls a traumatic event while simultaneously undergoing bilateral stimulation that can consist of moving the eyes from side to side, vibrations or tapping movements on different sides of the body, or tones delivered through one ear then the other via headphones. Other individual therapies that are commonly used are cognitive behavioral, psychodynamic, and feminist therapies, which are used and most successful when specific to the individual. Group therapy is used in order to lessen the isolation survivors feel, then provide a supportive environment.